All right, Shalom. Giving all praises, glory, and honors unto Yahweh, Ba'ashem, Yahushua, Ba'ashem, Kakudash. The belongings to the apostles, the bishops, the elders of Great Millstone. Peace and blessings to the 144,000, the rest of the hopeful elect out there. It's your brother, the priest, Zion from GMS Atlanta, back with another edifying video. And this is one step closer to the MOTB, which is the biochip, the biometric implant,
90,
the micro C-hip, and the system that the MOTB will utilize is constantly going under new development. Okay. Amazon has now updated its palm reading technology to the healthcare sector, the healthcare system. Bear with me 1 second. All right, so previously Amazon used hand scanners or palm scanners in their Amazon Go stores, or I believe Whole Foods as well, to where you can use your hand to buy groceries, right? And now that technology is now moving towards being set up in different medical institutions. And like I said, that's a step closer to biblical prophecy being fulfilled. So it says Amazon expands its palm biometric payment to healthcare. See, we here at GMS, we've been saying this for years, that they're going to introduce biometrics, hand scanning, technology. They're definitely moving towards digital identification, not just in the U.S., in the States, but also around the world. It says the UAE, which is the United Arab Emirates, all right, the UAE banks launch contactless palm vein payments. All right. Now, this isn't the MOTB, but this is a step closer to it. Okay. It says Amazon is one of the major companies to introduce palm biometric payment, and the e-commerce giant is now expanding the system to healthcare. The Amazon One biometric authentication system was first introduced at Amazon Go, yep, just like I said, cashierless retail stores in Seattle before it was deployed to the Whole Foods grocery chain. Yeah. See, we follow, right? We follow this technology, which proves that we got to be the men of the Lord here at GMS, the prophets, because we're watching for these prophecies in the news and different reports around the world to bring it to the hopeful elect of the Israelites out there. It says now Amazon One will be implementing at NYU Langone health facilities. All right, or Lang One. All right, I'm not familiar with that out of New York, but and it's a step closer, right? So they're setting it up. It says it will be the palm scanning platform's first application in healthcare, with Amazon One deployed across the 6 hospitals and more than 320 outpatient centers that NYU Langone operates. Patients will be able to check in for appointments using Amazon One. So this is definitely a testing for the micro C hip, right, the implant, because they're moving it beyond groceries, buying and selling. Now they're moving it towards medical and healthcare, which because they want it to be a pretty much you're going to have to use your implant, the MOTB, for everything. Okay, you want to go to work, instead of scanning your badge, you just scan your hand. You want to go to the grocery store, of course they have it, you scan your hand. You want to go to the hospital, if the doctor and nurses, they need to identify you and get your health care and insurance records, scan your hand. That's what they're doing with this technology, and they're testing it out in these different sectors. So it's no coincidence that now they're moving it towards healthcare, because they're going to need that approval for the implant from the FDA, which they really already got it. But if they can have it where the technology with Amazon and the palm scanning, if it can seamlessly transfer between buying groceries, Snicker bar and cereal and a pack of chicken, if it can transition between buying groceries and checking for your healthcare records, then that's a win for the elites. All right? It says, speaking to CNBC, NYU Langone executive Andrew Rubin said the technology is expected to streamline check-ins, right? Remember, the key thing to pushing the MOTB, because they want everybody to take it, is convenience, right? Voluntary at first, and then eventually it'll be mandatory. All right? So it says the technology is expected to streamline check-ins, reduce admin for front office staff, and decrease wait times. Addressing privacy concerns, the medical organization said Amazon will not store or access any patient health data or personal information beyond palm prints, as Amazon One users must sign up to use the palm payment system. Patients can opt out at any time, while participation is voluntary. Right now it's voluntary. But when they introduce the physical digital implant, which is the MOTB, because the palm scanner isn't the MOTB. That's not the mark. The mark is the physical technology that they're going to cut under your skin. Once that is introduced, it won't be voluntary, right? Or it'll be voluntary at first, but then they'll make it involuntary. All right? The technology is anticipated to reduce the time patients spend at front desk, currently 2 to 3 minutes, down to less than a minute, which adds up to significant time savings for the more than 10 million patients who visit annually. Palm biometric authentication has been credited for its high accuracy, said to be greater than that of fingerprints or face biometrics, and convenience. See, and another thing, the MOTB is the system is in place. They're putting the digital infrastructure in place for you to use it, but it's going to go beyond using your face or your fingerprint. They're going to say, no, using your hand is much better, okay? It says, while biometric authentication can reduce fraud and administrative errors. So, let's do this, right? Using your hand, according to prophecy, is going to be a lot more convenient than using your face or your forehead, right? Because it's, people use their hands every day. Revelation 13:16. And he causes all, both small and great, rich and poor, free and bond, to receive a mark in their right hand or in their foreheads. It says or. So you can put it in your hand. Doesn't matter which. It could be right or left. Right hand just means your dominant hand. Or in their foreheads, which you already have the Neuralink implant is already going through human trials um, here in the U.S. It says that no man might buy or sell, right? They're already using palm scanners in Whole Foods grocery stores through Amazon, and that no man might buy or sell, save he that had the mark, or the name of the beast, or the number of his name. So they're already setting it up. All your information will be stored, not in Amazon's database, but in the implant itself. Okay. Now here it says. Okay, let me see. NYU Langon said the Amazon One will be available at sites in the New York metro area from next week, with expansion to other locations expected later this year. So they're getting this thing on the roll next week here in March. They're already pushing this technology. So what, March 2025? So by this summer, there's no telling how many locations in New York will be using this technology. And then once it's successful in New York, which I believe it will be, it'll be pushed in other cities, maybe Chicago, maybe Los Angeles, here in Atlanta, Florida, Texas, all over the Midwest. Now, banks using this technology. The United Arab Emirates is going big on palm biometrics as the Middle Eastern country prepares to make palm payment standard across all banks. Listen to what Great Millstone has been telling you. This is why the Lord is exposing the false prophets, the liars, the scoffers. Okay. IUIC, Sakari, IGBK, all right, all these other groups, Genesis, they're all being exposed as not being the men of the Lord, not being the true prophets, because they don't really push the scriptures. Now Sakari pushes the implant, the MOTB, being the micro C hip, all right, or they believe it, but they don't really push it. But that whole group is being, broken up for other reasons. Now you have it to where in New York, they're pushing scanning your hand to get into these hospitals and check into these hospitals. So what is Captain Tazaryak and General Yohana and these other groups, HOI, they don't believe the MOTB is the micro CHIP either. What are they going to say? Because this is in the news. What it mentioned CNBC. CNBC, right? Amazon to bring palm scanning tech to NYU Langon Health facilities. So tell the priest about when he's out on the street, HOI, since they talk about news and different gossip and what's going on, tell him to talk about this. And if it ties into prophecy, right? If it's a step closer to the MOTB, or someone ask it, See, ask Sabak about this. Hey man, we're just telling you. Here it says, launching under the promo, Your Vein, Your Identity, the project will see the United Arab Emirates Federal Authority for Identity, Citizenship, Customs, and Port Security joining forces with UAE banks in deploying the system. And I believe they already are introducing as well, or they're getting ready to introduce digital IDs. So they're using it, they're going to launch it in the Middle East. It says recently a global head for JP Morgan Payments said palm-based biometrics, and I did a video on this. okay, are a crucial component for the company's overall biometric strategy, as major players such as Visa, Tencent, and MasterCard deploy the technology along with implementations in various cities around the world. So, yeah, this is definitely a step closer to that prophecy, Revelation 13 and 16 coming to pass. All right? Um, yeah, now this here, vendors make their case while biometrics and the healthcare sector go together. So this is just like a update to this news here. Companies such as Amazon have been introducing biometric authentication systems into the healthcare sector. This is from March 7, 2025. Okay, so this is recent news. It says adapting as Amazon One Palm biometric system to the NYU Langone Health facilities in New York. This is prompting other industry players to lay out their arguments for why biometric systems should be used for handling sensitive patient data and the complications that may arise. Why not just keep it in a computer system? Why you gotta have it in your hand? Why you need biometrics? Because they want to introduce that mark. That's why. Many outpatient clinics use different electronic health records, and without a universal biometric standard, data sharing between providers becomes difficult. So this is their excuse, right? A patient identified by a fingerprint scan at one clinic may not be recognized by a facial recognition system at another, resulting in fragmented records and inefficiencies in care coordination, according to a blog post published by patient identification platform Right Patient. What happened to just carrying your healthcare, insurance card in your wallet or your purse, Pull it out, they type in the information and go. It might take a few minutes, but whatever, But this is Esau pushing that system, saying that the old way is not working, right? The old world, so they want to push for this new digital world order. Okay? So they're pushing for biometrics, and they're giving you the different reasons why. Voice biometrics, face biometrics. It's all about them pushing this new system. Oh, digital ID. It says technology company NEC has its own recipe for securing patient data or data. The NEC digital ID, which relies on facial biometrics. The NEC digital ID, which relies on facial biometrics. Biometric systems used by healthcare institutions should only store encrypted biometric templates. They should be designed to meet specific needs of healthcare standards and adhere to strict standards and regular audits, the company says in a blog post. So, you tell me who's been right, man. GMS has always been right when it's come to this technology, and we're another step closer to the MOTB. Amazon wants to use its palm scanning technology, right? According to CNBC, major news, they want to use it in different health facilities, not just New York, other cities around the world, including in banks in the Middle East. So, hey, with that, I'm going to close out, giving all praises, glory, and honors unto Yahweh, by Hashem Yahweh Shai, by Hashem Rakah Kodash. Shalom.